So welcome everybody. My name is Paula Deda. I'm working for the United Nations and the Economic Commission for Europe, and I'm very happy to be your moderator today. I'm going to take a few minutes for the introduction so that more people can join us. It's just 3 o'clock right now. In the meanwhile, let me welcome all of you to the second Geneva Urban Debates. The C is a series that is coming together thanks to the co-organizers, the UN Habitat, Geneva Cities Hub, City Cancer Challenge with the support of UCLG and Devex. And this is coming to life because of a very important report that was recently issued. And again, as we have a speaker that will present you, introduce you to the report in very much detail, I will not dwell too much on that as I don't want to take away information from what she will share with you. What I wanted to mention to you is that I believe this event is extremely timely. Our cities have changed, our life has changed, our health has changed very much over the last 2 years. And there is no need for me to tell you what is the cause and why, but what we have all experienced is the importance of two elements in our lives, our health and our cities. Cities were out there to immediately react to the emergency and to respond to the emergency the best way possible. And many of the cities that had to address it were up to the task. They really got their they got organized, they got their administrations together, and they were really to face the difficulties. But we also know that health is not is a larger problem. It's not only related to COVID. There are many challenges out there. Some are silent emergencies. I believe cancer is one of those. It's just because it continues and never stops, it doesn't mean it's not equally a very important emergency. And this also stresses the importance of giving and reading the development of cities and their ability to implement the SDGs, the Sustainable Development Goals. I don't think I have to introduce this concept to all of you, through the lenses of health. And this is a bit what we are trying to do today. We have really eminent speakers. I will introduce to them. So I would say that without further ado, we will now hear from the president of the Geneva City Hub and Vice Mayor of Geneva, Mr. Sami Kanan, with his welcoming remark.
Ladies and gentlemen, dear colleagues, dear friends, I am very pleased to welcome you to the second Geneva Urban Debate, co-organized by the Geneva Cities Hub, UN Habitat and City Cancer Challenge in partnership with UCLG and Devex. Geneva Urban Debates have been launched this year by the Geneva Cities Hub and UN Habitat to highlight the role of cities in relation to issues that lie at the heart of the international Geneva ecosystem. Too often, cities are being sidelined in international debates in spite of the catalytic role they play in tackling the world's global challenges. We therefore wanted to provide them with a dedicated space to share their experiences and local solutions which can then be scaled up at national level or even replicated in other cities. Today's event will precisely look at the catalytic role of cities in driving progress towards the Sustainable Development Goals. It will be interesting to hear from a diverse panel about what makes city-led initiatives successful and what solutions have been found to overcome the bottlenecks. I very much hope that today's debate will clearly demonstrate the added value of concrete city-led initiatives and bolster support by a broad range of stakeholders to reach the SDGs. I wish you a very fruitful discussion and look forward to continuing engaging with you on urban issues. Thank you very much.
Thank you, and thank you to Sami Kanan for his message. I think the message also this is sending us very clear. What is city-led and what is very concrete? And this is really what our event today is focused on. Before I give the floor to the panelists, allow me 3 minutes just to introduce you briefly to them, to their background and career, because I believe it's very relevant for the rest of the debate. Let me start by introducing you to Dr. Susan Henshaw. She's the CEO of City Cancer Challenge Foundation. Hello, Susan. Susan is the Chief Executive Officer of City Cancer Challenge, CCAN, an independent Swiss foundation which supports cities as they work to improve access to quality and equitable cancer care. I have a long bio from Susan, but just let me mention that she is really the one behind this work. She laid the ground and concept for the development of CTCAN, after first working as a consultant and then as a director of the Geneva-based Union for International Cancer Control. Susan, you also have a background in health and hygiene. I see that your career path was defined in 1995 after completing a postdoctoral work at the London School of Hygiene and Tropical Medicine in London, and then returning to Sydney to take up the leadership of an internationally recognized multidisciplinary cancer research team at the Garvan Institute of Medical Research. So welcome, Susan, and welcome, actually, thank you for hosting all of us. Next on my list is Dr. Oneika Erobu. I hope I pronounce your name correctly. Let me know in case. Is that correct, Oneika? Oneika.
Right on, Paula. Right on. Thank you.
Very good. She's Senior Advisor for Health of the City of Freetown, Sierra Leone. Thank you so much for joining. I've been reading a bit about what you're going to tell us, and it is extremely interesting. I'm quite excited. Dr. Oneika Erobu is the Senior Health Advisor to the Mayor of Freetown, and the Mayor is Yvonne Aki Sawyer, OBE. She's committed to using an inclusive, data-driven approach to addressing health challenges in the city, and this data-driven is really also something we're going to really focus on today. A health professional with over a decade of combined experience in clinical medicine, public health, project management, strategic planning, and policy advisory, Dr. Ebu's engagement with the public sector spans the duration of her career. So again, you also come from the health sector, but you recently also co-led conceptualization, design, and implementation of the Urban Farming Initiative, a pilot intervention targeted at reducing food insecurity and improving nutrition for 300 households across 3 informal communities in Freetown. I'll stop here. More about you. Of course, you're a medical doctor with a master in public health from University of Warwick, and also a master in public policy from the Blavatnik School of Government. So you're really bringing these two experiences together. I have to say, we'll come back separately to ask you about this farming initiative, because this is also very relevant for cities. And when we talk about health, that's also extremely relevant. Then I have Shalini Singarevelu, I hope is correct, Program Manager of the Health Initiative IBM. I'm very also excited having private sector with us, because it's absolutely has shown the relevance during the pandemic. Shalini is a program manager in the IBM's corporate social responsibility team based in the US. In this role, she supports digital health innovations and partnerships addressing disparities in global cancer control. Her background is international public health, and prior to joining IBM, she worked on outbreak data system and epidemic response with the World Health Organization. So I guess very much really the person we are looking at today, especially in this time of pandemic and digitalization, because I just got actually my digital certificate. So voila, this is what we are talking about. And last but not least is, we left the man at the end, Graham Alabaster, but doesn't mean that it's last, but definitely again not least is Chief of UN Habitat Geneva Office. Graham is a public health engineer by profession and is in UN Habitat's head office in Geneva, really next to my office actually, where he represents the UN Habitat USG and is responsible for liaison with Geneva-based member states and organizations. Graham has over 35 years of experience in the urban sector and has worked in over 50 countries in all regions of the world. And after an early career in academic research in the UK and Africa and a period in the industry, he joined UN Habitat in 1992. So I hope I gave you really an idea of the speakers of today, their knowledge and relevance. And I'm going to now move to the speakers and to listen to the stories and the case studies they're presenting. And I start from Susan, really starting from why your organization commissioned the report, if you can tell us a bit more, and what, and do the findings reflect your own lessons learned and experience? And if you can really introduce us to this report, that will be very interesting also to lead to the next speakers and their examples and case studies. Over to you, Susan.
Thank you so much, Paula, and thank you to everyone who's joined us today. I think we actually have brought the issue to the table right away with the diversity of experience and the diversity of backgrounds that are represented on the panel today, because we all know that the Sustainable Development Goals include a dedicated goal, SDG 11, to cities, making them safe, inclusive, equitable, resilient, sustainable. But of course, we also know that cities play an enormous role in catalysing action across all the SDGs. And the diversity we see today and the case studies we're going to hear today really reflect that view and that perspective that came through in the report. Cities are driving change at the local level. So of course, while the scope and ambition of the SDGs is very much global, we can safely say that implementation is at the local level. And really, that's why by the Union for International Cancer Control here in Geneva, and then subsequently as a standalone organisation in 2019. We really wanted to take that viewpoint from a local perspective. So understanding how we could work with cities from the ground up to improve access to quality and equitable cancer care. CCAN currently works in 9 cities around the world in 4 different regions. And really the model of CCAN, I think, is very much reflected in the outcomes of the report, Paula, because really we have a set of guiding principles, and it was so exciting to see that in fact the enablers and the success factors that came through in the report, which was the objective of commissioning this, really reflect our own findings and the model of CCAN. So just to perhaps give you some little bit of context to that. So when City Cancer Challenge works with cities, one of the first things that we do is convene the major decision makers in the city. At every city, we convene a group of 12 to 15 individuals representative of the ecosystem across the city and the care network for oncology. And those decision makers form a group called the City Executive Committee. These are the individuals that steward the program from start right through to our 2 to 3 year program and help the transition into a sustainable model. These decision makers really are the ones that keep the priorities local. And that really brings in one of the first findings of the report, which is the importance of local initiatives being data-driven and by local data. So I know that I'm sure Shalini is going to talk about this, and I'm sure others, but I think one of the key findings of the report, of course, was that effective data use drives strong awareness of city needs. So one of the next steps in the CCAN process is to conduct a needs assessment across the city. That takes in all of the institutions that are delivering cancer care, as well as policymakers, as well as getting perspective from patients. And we've been all together convening 149 institutions from across the 9 cities that we work with, and over 1,200 health professionals have contributed now to that needs assessment process. So it really reflects the importance of gathering and consolidating the local insights in order to set priorities for each city, so that they focus their efforts very much on planning and implementation around the areas that they think are the most important to them. The next part of the CCAN model is really then to support cities to bring a group of stakeholders, local, regional, national, international, to help cities actually implement and execute their priority areas. So here we get into a really powerful finding from the report, was the importance of multi-sectoral approaches. And for me, I was actually thrilled to see 96% of respondents flagged multi-stakeholder collaboration. I don't believe we would have seen that 10 years ago, and I don't even think we would have seen that 2 years ago. I think the acceptance that multi-sector collaboration is absolutely intrinsic to success at city level, and actually to all programmatic work is fabulous. And not only that, I have to really add that over 70% of respondents, in addition, flagged the importance of having private sector and at the table in a creative, co-creative and fully meaningful partnership model. So that means bringing innovative solutions, it means bringing technologies. This is true partnership, and I think that change has also been accelerated over the last couple of years. I don't think we would have seen that from respondents a little while ago. So a very exciting change in mindset. The other piece I really want to highlight, which is really also about the CCAN model, is that when you are relying on locally led, locally driven efforts, and including in health systems and including in cancer, one of the key things is to build trust. You are bringing together stakeholders from the very beginning of a very intensive due diligence process, through the stakeholder engagement, through this needs assessment and project planning and execution. It's a long journey. You need to really want to be part of it, and you really need to have the trust and the support and the respect of the people that you're bringing together on the ground. It was really interesting to see that 60% of respondents said that lack of trust between stakeholder groups was one of the key barriers to actually making progress. So the really takeaway lesson for us is that the time we take to build partnerships, to bring people together, to convene stakeholder groups, to make sure that people really understand where each other are coming from and align around a common vision, is critical to taking those next steps. I'm conscious of time, so I will stop there, and I really look forward to hearing our other panelists and how they feel that they have responded and their perspective of the report. So thank you very much.
Thank you, Susan. Thank you very much. Well, first of all, congratulations. Just for the audience, I see there are many people following us. We were talking about this report is accelerating progress towards the SDGs through city-led initiatives. Probably you have seen already the link sent to you. I went through the report. I suggest you read it. It's really a modern report with a lot of infographics and data, very interesting data that stick to you. So congratulations. By the way, this is an excellent example of what SDG 17 is. This was a true partnership also to put it together. So voila, a concrete example of this. Next speaker is Dr. Oneika Erobu. And now we are diving into the specific case studies. So let me just ask you directly the two questions that I had in mind. So we hear of your experience. So what has been the city of Freetown's approach to addressing the SDGs and the key challenges and lessons learned? And also then I would like to hear from you if you have specific examples of city-led actions, because we are talking a lot about ad hoc, about priorities at the local level, but what about city-led actions? Over to you, Oneika.
Thank you so much, Paola. And it's been a pleasure just listening to Susan speak, because she brings the real life situation into what we're talking about today. I would start by saying that Freetown operates or the vehicle for actually saying that the Sustainable Development Goals are achieved in Freetown is called the Transform Freetown Agenda. And the Transform Freetown Agenda was launched in 2019, in January 2019. And it pretty much was the development process involved digging into our local expertise in Freetown, getting in touch with our stakeholders in Freetown, people who had significant knowledge about the city, and working with them. And what we did during the development process, we brought like several stakeholders, and we formed multi-stakeholder working groups. Stakeholders included key actors from the public sector, from the private sector, the social sector, and let's not forget about the communities, because cities are made up of communities, communities are made up of people. Now, the Transform Freetown agenda is comprised of 4 major clusters, namely resilience, healthy city. We have human development, which is strongly targeted at women and girls. And then we have urban mobility. These clusters are further divided into priority sectors. So we have 11 priority sectors. For example, under healthy city, we have 3 priority sectors, mainly health, water, and sanitation. I want to highlight the fact that the Transform Freetown agenda, every priority sector under this agenda is closely linked with the Sustainable Development Goals. And in particular, we focus for every priority sector, we make sure we focus on SDG 11, which mainly targets, building sustainable cities and communities, and SDG 17, which really is targeted at promotion, partnerships and collaborations to ensure that we achieve the SDGs. And we also can do this in a silo manner. So these priority sectors are also aligned with Sierra Leone's National Development Plan. And so what this means is that if we make progress with the Transform Freetown agenda, in essence, we are making progress with achieving the Sustainable Development Goals in Freetown. Now, Paula asked a question: what have been the key lessons? It's been amazing because we have seen what community engagement and community participation can do. And we have come to realize that once you get communities to buy into your idea, once you get them to get into the front seat, once they know that you are listening, once you are able to build trust, there is no ceiling to what it is that you can achieve, in a city. The second thing also that has come through is that multi-sectoral collaborations are very necessary. Remember, I had mentioned earlier that in trying to develop the Transform Freetown agenda, we had several actors. These actors all had their interests, but they had to come to the table and they had to say, these are the needs of the residents of Freetown. We must align our priorities. We must align our interests to what the city of Freetown requires. So that has also been a major factor. And then I also want to mention the importance of data. Every time people talk about data, many people think about quantitative data. But at the time the Transform Freetown agenda was being developed, there was a dearth of quantitative data. And so we had to step back and think about creative ways to get information we needed to propel the city forward. And so we leaned heavily on qualitative data. We leaned on focus group discussions within communities. We leaned on narratives, photographs, even videos. We brought everybody to the table. We brought community representatives to the table, people that spoke about what their communities need. So when we talk about data, let's not be skewed to only quantitative data, but we must be creative in finding other sources of data. What have the challenges been? A major challenge in trying to implement our Transform Freetown agenda is the fact that many times institutions, city-level authorities work in silos. So even within local governments, even within the city council, you find that departments and units or agencies are working towards their own agenda without getting every other person involved. Many times we do not even have platforms to share information, to share knowledge, to share our data. So that has been a significant problem, a significant challenge in trying to just, achieve our targets in the city. Another one really has been centered around capacity and competence of the city council. And while this is a challenge, we keep, coming up with innovative ways to enhance performance of, staff. to also look for ways to develop staff. We are part of several networks globally that, which serve as platform for us to glean knowledge from others. And essentially we've come to realize that peer-to-peer learning, peer-to-peer knowledge sharing can never be underestimated. So this is the case for Freetown. Thank you.
Onika, you did not answer my specific example question, but we will come back to this later because your time is up, but I'll not forget, I will have it there. Thank you so much. It's very important to stress community engagement. I have the feeling that perhaps the pandemic, if there was one important teaching from it, was exactly that. And when you have catastrophes, that people come together. So not that I'm wishing that, but we have to build on this understanding now and really use it to the benefit of people and cities. Next on my list is IBM Shalini Singarav. I can't really pronounce your last name. I seem to have difficulty. Singaravelu. Is that correct? Very
yes.
Good. So Shalini, I have a question for you on the experience of IBM and its perspective on taking a city-led approach to health and other SDGs.
Sure. Thank you so much, Paula. It's a pleasure to be speaking with everyone today about our project, specifically to improve cancer pathology reporting that was piloted in Asuncion. So I'll focus our just introduction on that. We all know that it takes a village. So first, I'd just like to thank all the IBM participants and the project focal points from City Cancer Challenge, INCAN, which is the National Cancer Institute of Paraguay, the American Society for Clinical Pathology, and the International Collaboration on Cancer Reporting, whose vision, direction, and hard work really made this project possible. So just a brief background, back in 2020, our team was asked to tackle one of the most complex challenges to addressing global cancer disparities, and that was the need for better quality, more timely information from cancer pathology reports that was used to confirm cancer diagnoses, inform treatment planning, and guide national cancer control policies. And we were asked to do this through a digital web-based tool. So part of our experience and really how our project operated was on three fundamental principles, which were co-creation, multi-sectoral expertise, and person centricity. For co-creation, we began with co-creation at the earliest stages of planning by bringing together our project partners to design the scope, the vision, and the measures of success. Once the IBM team landed in Asuncion, we really relied on the knowledge and the relationships of the National Cancer Institute that's based in Asuncion, as well as some of the past assessments, thanks to City Cancer Challenge and some of the partners that really aligned the local stakeholders and partners on the ground on the need for improving pathology reports. This really provided a solid foundation for the IBM team to then engage and co-create with public and private hospitals and laboratories, the Ministry of Health, as well as technology professionals and the National Cancer Registry focal points. We also facilitated conversations between national and global experts to jointly prioritize solution features. Next, with regard to multi-sectoral expertise, the project brought together IBM as a technology partner and as a consulting partner, the Ministry of Health, National Cancer Institute, pathology expertise and global standards for pathology reporting that came from the American Society for Clinical Pathology and the International Collaboration on Cancer Reporting, as well as City Cancer Challenge, who had already been working in Asuncion, had great relationships to improve cancer care, and was working in public-private partnerships. Lastly, the process of designing the digital tool was guided by human-centered design and design thinking principles. So to keep people at the center of the technology, the team was really immersed in the day-to-day challenges of pathologists in Asuncion by conducting site visits, workshops, and interviews throughout the development process, and by testing iterations of the tool with local and international pathologists for feedback, and as well as remaining authentic, like Susan mentioned, building trust to the outcomes of the project. There were a few challenges throughout the process. One was the need to really embrace the diversity within Asuncion in terms of resource availability between the different types of hospitals and laboratories, and to develop a digital tool that was flexible for use in all varieties of health contexts. The next challenge was also to balance the perspectives of the need for global standard setting by international organization with the local needs in Asuncion. One of the project successes was that the rapid prototyping process really supported an engagement and exchange of knowledge and skills. Pathologists in Asuncion informed us about their realities, their challenges and barriers. And our IBM team also worked together with technology focal points from the Ministry of Health, the hospitals, and the National Cancer Institute to exchange perspectives and recommendations on how data systems could be improved. The prototype was also developed with sustainability and scalability in mind from the start. So in terms of product features, that meant building the tool to be resilient to internet and power outages, user-friendly, flexible to integrate with existing information systems or work as a standalone tool. And in terms of process, that really meant ensuring that the Ministry of Health and National Cancer Institute had the necessary tools, materials, and trainings to take the tool forward into its next phases. Thank you.
Sorry, I was muted. I was saying that's very interesting to see the future and to listen what you're describing, and I can also imagine how digitalization will have a crucial role in our health in the future. And it's the fast information, is the correct information, is your needs that can be fast assessed. So well done, and we hope to see actually that this role of the private sector enhanced in the future to really help also communities to access services much more efficiently, or the right services, or and really share information in the correct way. So well, it's impressive what is already happening. If we would just go back in time 10 years ago, we could not imagine something like that. Now, let me go to the last speaker. I said definitely last but not least is Graham Alabaster. Graham, I'm going to ask you a question really related to your work and the work of UN Habitat. In 2020, UN Habitat launched a new strategic plan, which has 5 flagship programs to accelerate progress towards the SDGs. Can you tell us in a nutshell a bit more about this plan, and how can also help the cities, communities, and health communities to advance their work on the SDGs? Over to you.
Thanks very much, Paola. I hope you can hear me okay, and great to be with this event and to listen to all of you speaking before me. Absolute pleasure to be here. Before I answer a little bit about that, Paola, I just wanted to make a comment in relation to the multi-sectoral processes. And this is very central to a lot of what we do at UN Habitat. I think, it's sometimes forgotten that, cities are really the catalyst for multi-sectoral processes, because they're the only people who know, looking up towards national government, what's going on and how it works and how to express themselves, but also looking down to a mixed community. So, I mean, I think it's now becoming a realization, and particularly post-COVID, that, cities have got this unique role to play in guiding above, helping national governments to understand multi-sectoral processes, which don't actually always happen very well at national level, and also unlocking the potential of communities, as we've seen from many of the speakers this afternoon. So about Habitat's program of work, yes, we had a new strategic plan in 2020, which basically comes around 4 areas. The first area is relating to reducing spatial inequality and poverty. As many of you know, national statistics hide the huge levels of inequity that are seen in our society. And, something like the COVID pandemic shows this inequality up even more. We see this. So our first effort is to look at reducing this inequality in cities, but of course, without knowing about how the level of inequity and where the pockets are within urban centres, you have to get good data. So, and we've heard it already from several people, but the data, yes, is needed to make these necessary local level decisions. But in many cases, a lot of the institutes, even at local level, don't have the capacity to analyze that data. Most local authorities are extremely stretched, and they don't have the luxury of analysing that data locally. So, I mean, this programme is the first area of our work is to try and assist cities as much as possible to build the capacity to analyse, interpret their data, which of course the ultimate aim is to promote investment. You know, not just from national government resources, but from outside investment, but more importantly, to harness the potential of private sector resources. The second area is looking very closely at enhancing shared prosperity. And a lot of this is enabling all people in a city, all sections of society, to benefit from improved livelihoods. Now, we've got many opportunities because of things like smart cities now for small businesses to be started in cities, even amongst low income or poor populations. So really, you know, this is a very important area of work. The city overall is only going to be as good as the quality of the life of the poorest in that city. And that's what we have to do. If we increase the standard of living of the people in the poorest parts of the city, we stand for the whole city to gain in prosperity. So that area. The third area, of course, is, and this I'm sure doesn't surprise many of you, is how we tackle climate change. Although climate change is a global problem, of course, cities are responsible for most of the emissions and are the only way that we can, you know, see that we reduce global warming. And also city residents and those in urban areas, you know, need to live in a robust environment, somewhere that's safe and can cope with the extreme weather events that that climate change brings. Many cities, local authorities really don't have, again, the capacity or the resources to make their cities resilient to these climate actions. And if we don't manage that, things like an area very close to my heart, water scarcity in cities, is going to be a very big reality. And that isn't just in, you know, the water short areas of Africa and other parts of the world. It's in Europe as well. We're going to see many European cities who are faced with things like water scarcity because of climate change. And the fourth area is related to urban crisis management and response. Now, again, in all parts of the world, we are seeing, you know, through natural and man-made disasters, we're seeing the movement and migration of people across the globe that in a way we've never seen it before. And what happens is most of those people who are displaced or suffer, they go to urban areas where they are hosted. Now, you know, the ability of an existing urban setting to assimilate those inward populations is, of course, very limited in many cases. But, you know, there are also opportunities because in many cases, if there are resources available to support migration and support refugees and displaced people, there's this dual opportunity of raising the quality of life for the existing host communities and the incoming migrants. So this is really what this fourth program area is looking at. It's trying to make city governments, give them the tools and help them to cope with these influxes of migration, which are going to happen. And I mean, we're seeing it in European cities, of course, as well. So it's not just you know, in other parts of the world. So in a nutshell, those are our sort of four key areas of the strategic plan. We've got a series of flagship programs which are supporting those. I won't go into too much detail because of limited time. But, you know, the whole idea is that we're looking at people-centered approaches. We'll look at inclusive, vibrant projects. And of course, our main mandate is about looking at the poorest in the city, in slums and low-income areas, and helping those in the best way we can. But, you know, this is for us very important. This is why we're one of the only UN agencies that works, well, the only UN agency, but where our mandate is to work directly with local authorities and support local authority systems. So I think I'll stop there. I'm sure I've gone over my 5 minutes, but in a nutshell, that's what we're trying to do as UN Habitat. Thank you, Paula. I think you're muted, Paula.
Sorry, yes. No.
I think you're muted, Paula.
Sorry, yes. No, I was saying that it's always very interesting to hear you speaking about the global picture and the work of Uninhabited and putting all this into context. So thank you so much. I'm starting to see the questions popping up, so I will not. We'll just go straight to the questions. I know I have one question that I still have to ask Oneka. Let me go through the first two I see here. The first one is for Susan. There has been a lot of focus on sustainability and scale, and one of the ways to do this is by leveraging and sharing learning. If we take the example of IBM in Asunción, how have the learnings been scaled or applied elsewhere? Can you tell us a bit more about this? Actually, scaling up and how you can really replicate is essential in this case. So we would like to hear a bit more from you.
Thanks, Paula and Shalini. Since this was driven very much from your organization, please jump in. And I think the question is really valid because there were really important learnings from the work in Paraguay that have already been transferred to Ghana. So right now, CCAN is working with local stakeholders, taking that same design-centered approach that was really brought to the fore in the Asunción work with IBM and others, to look at how we can address a very similar problem in terms of pathology reporting and the transfer of information across pathology reporting and make that sustainable. So it's a very, it really can't be emphasized enough that we need to always look for avenues of knowledge exchange. Part of making programs sustainable is ensuring, in this case, that everything that was learned through the Paraguay experience is transferred as we go to a slightly different model, but exactly the same type of work in Ghana. The importance of what I would say responsible scale. So it's not just about making it broader.
I think we have lost a bit. I don't know if you can hear Susan. I can't.
Do it again in the next city. We learn more.
All right, Susan. Sorry, we lost you a bit at the very end. But I think we got the most of your intervention. And as we are on replicability, we just got a question coming in, Nika, for you. A question to Dr. Arobo. To what extent is the Freetown model replicable to other cities in Sierra Leone and beyond? And perhaps you can take this question and this opportunity also to refer to a specific example that we were mentioning earlier. You might just give us a few words about that as well.
Thank you, Paula. So the Transform Freetown Agenda pretty much is the first of its kind in Sierra Leone. Because of the progress we have made so far, we've had other cities coming to us, I mean, within Sierra Leone. So we've had Bo, we've had Kenema, we've had several other, city councils approaching the mayor, approaching our city council to kind of learn the processes that went into, co-creating this co-creating the Transform Freetown Agenda. And we also have them visiting to learn how exactly we are able to implement the interventions that were prescribed in the agenda. So it is replicable. Again, just as Susan has mentioned, when talking about replication, people also would ask you about scalability. And so what we try to do in Freetown is we take a very seasoned approach, step-by-step approach towards scaling up. And the idea really is that we want whatever interventions that we're implementing to be sustainable. So yes, it can be done. Cities around Sierra Leone are coming to us, because we are setting the pace, and we are also in talks with, Kenefin in Gambia. We're in talk with the mayor of Monrovia, Liberia, simply because of what we are doing, and they are looking to use our model, within their cities. I think I've answered the first question, and the second question has to do with a specific example regarding the kinds of progress you can see when you get communities actively engaged. I want to just make reference to what is called the cleanest zone competition. So it is a competition that holds annually or has held annually in Freetown since 2019. And essentially what this is about is ensuring that Freetown meets adequate sanitation standards. And so while we are trying to approach this problem from, we try to approach the issue of sanitation in Freetown from two angles. We deal with the upstream angle, which essentially is just trying to solve the structural issues that pose challenges to ensuring adequate sanitation in Freetown. But we also look at it as well and try to address this issue from the downstream component, which has a lot to do with behavior change. And so the communities actually came up with this solution during the creation process of the agenda, and say, let's look out for the cleanest zone in Freetown. And so we have 322 zones in Freetown, and essentially the criteria pretty much are which zone is cleanest, number two, which zone has taken much effort for beautification, and the third one is which zone has sustainable solutions, to see progress in their communities. And we were able to monitor and evaluate this competition with funds from the Irish Aid. The Chinese embassy provided street lights for us, as a prize. The prize itself came from the Freetown City Council's internally generated funds. And the very first zone that won this prize, the Jalo Terrace zone, they won the prize, or the first prize of $10,000. And what they did with this money was they rehabilitated a road in their community. They got a 10,000 water liter tank in their community because water supply is a major problem in Freetown. They sponsored 10 children to school. And so this just tells you that when you get communities really involved in interventions, they take it, they drive with it, and they know what they really need. Ours is a prototype. I want to say that ours is a prototype with lots of documentations for knowledge sharing, and we continue to do that, using the platforms that we are a part of. Thank you.
Thank you so much. It's very interesting, and I can tell you this discussion is very interesting also for the questions that keep popping up on my screen. The next one is Graham, is for you. One of the participants wants to know which cities are you collaborating with to address climate change and improve crisis management?
I've just actually written a reply to that. I've asked him to, because there's quite a long list, and I'll have to get my colleagues in Nairobi to answer that question. So yeah, Eduardo, if you drop me an email, I'd be only too happy to connect you with my colleagues who can give you the complete list.
Thank you, Graham. I don't know if I only see the questions. I don't know if you have answers to them. So I'm going to the next one now, which is for Shalini. One of our participants is writing, I love that IBM has such diverse interests and works with public infrastructure to startups. I was interested in knowing how did the effort come together, since this is a public health program, and provides examples. Who started this idea? Which organizations funded the effort? Who were other stakeholders and their roles? Over to you, Shalini.
Yeah, thank you for that question. So really the project came together as a team effort. It was first brought to us at IBM from the American Society for Clinical Pathology and the International Collaboration on Cancer Reporting. So really the experts who were well versed in the challenges of cancer pathology, as well as structured reporting and what those needs and global standards were. So their focal points there then connected us with City Cancer Challenge, who had worked so closely with Asuncion in understanding what the barriers and needs were in cancer control in the city of Asuncion, and as well as nationally in Paraguay. And working with them we were able to then match the issue that we had identified with the needs on the ground. And really, it was a matter of timing that Asuncion was ready to have a pilot engagement and to start a project to address pathology reporting. The timing was also unique in that at the same time, Asuncion had been working with IARC, the International Agency on Cancer Research, as well as PAHO, the Pan American Health Organization, to launch a national population-based cancer registry. And so there was an additional incentive for local stakeholders to improve the information coming from pathology reports, in the sense of being able to then improve the amount of information they were able to glean from their national cancer registry. And so really all these pieces had to come together and went step by step, really. And that's how we ended up getting involved in the project.
Thank you very much. I think you definitely addressed this question. So I'm going to move to the next one, which is to Susan. In Latin America, long-term policies are a challenge due to political instability. Do you consider that the City Cancer Challenge model of multi-sectoral collaboration provides sustainability not only in terms of financing, but also to protect the policies that emerge from this platform in the long term? Because only sustaining the policy on the long term, we can obtain results in terms of mortality reduction. Sorry, it's a long question, but I think it's very much relevant, and I would say touching upon a crucial issue here. So over to you.
Thanks, Paula. I'm going to address this from a digitalization viewpoint, and I'm very sorry, but I feel there is an internet issue here, so I apologize. So one of the things that has happened through multi-sectoral collaboration with CCAN, but also I think with every organization that's represented here and many others, is that there has been greater opportunities over particularly the last 12 months to digitalize, and particularly around health solutions. The pathology solution we've just been talking about is one of them, but there are many others in terms of particularly around data and data connection, making sure that clinical services and clinical information are connected across the city. A lot of this was not part of necessarily a priority for governments. So policy around digitalization and data privacy, for example, are two key areas where you really need all sectors to come together. And you really need that to be a sustainable action, because what you don't want to see is that there are digital policies and processes adopted at the city level, which then are unable to continue because the policy environment doesn't allow it. So I think that it's a very important piece in the puzzle. As the person who offered the question, it's not just about financing, it's not just about convening, it is about the policy environment and making sure that solutions like digital solutions are completely enabled at the national level. And then when you start to get into things like reimbursement models, for example, if you're promoting primary healthcare initiatives that bring patients together through digital health solutions, then you need to also consider in a policy environment things like reimbursement and how health professionals are going to access capacity building around using those digital solutions. Graham mentioned about data capacity building, but there's so many areas in terms of a policy environment that need to be strengthened so that, for example, in this case, we see often that a solution might be put forward even at the national level, but in fact the policy environment doesn't allow the health professionals to get the training and the infrastructure. Perhaps it's digital, smartphones, or perhaps it's some sort of other digital infrastructure, but that's not supported again by national policy.
Thank you, Susan. This is actually a crucial point. That is really the capacity building role, right? And having a tool is not enough. You cannot implement it or use it correctly. So this is actually the point also Graham was making, that this is also what the UN or other NGOs or foundations or member states themselves have to step in to make sure that digitalization doesn't simply mean that only a part of the population will benefit from the service. There is another question popping up right now, so give me a second. This is to any panelists who would like to answer. How does the relevance of SDG 11 and sub-targets change in the course of implementation? And if so, in what ways? Oh, that's a tough one. I don't know who wants to take that. Let me see if I have any volunteers to this question. Graham, you wanna start as sort of UN?
Yeah, I can have a go. Yeah, well, I think again, it comes back. I mean, what we've been doing as part of a lot of our programs has been encouraging what we refer to as the voluntary local reviews, which is basically the localization of the SDGs at city level. And I think this is, you know, the idea is to create a culture at city level of a continuous monitoring instrument rather than just a snapshot, which, you know, gives you the immediate thing. And I think this is really the only way you can track the progress, because you know, it's the same, exactly the same at national level. You've got indicators which have been debated. I mean, there was so much work went into picking the indicators of the SDG and their disaggregation. But we need to replicate that at city level. I mean, this is the issue. So I think the culture, and the other thing about this is that I think it's often forgotten that you know, you don't need hugely scientific, complicated monitoring mechanisms. You need blunt instruments to make decisions at the local level. You only need as much data as is needed to make a particular decision in the sector. And I mean, many of the sectors collect data, even though they maybe don't realize it. If you look at a city's water bills, or you look at their refuse collection vehicles, you can work out a lot from that information. But as I said, it's not, you know, not usually analysed, it's collected. So Habitat, of course, we're working on some of those indicators. I mean, solid waste, for example, is in goal 11, but having this idea of the spatial disaggregation at city level and having much more data on the socioeconomic background, if you can link that data to, in the case of, you know, we've been discussing this afternoon with health data, and you have a link of the health data to the living environment of where people are, this is when you can really start to move. This is when you can see how people are living in a vulnerable setting where they're, you know, they're living on marginalized land, but they're also next to the industrial area and they're breathing in, you know, pollutants which are causing NCDs and other things. So it's only when you have this data. And as I say, it doesn't need to be a complex picture. It just needs to be complex enough to make decisions. And you know, that's what we're trying to do at Habitat. We don't carry all the expertise for all of the sectors in detail, but we do have the more generalized data on urban settings. So that's, I don't know, hope I answered the question, but anyway, that's.
When we're talking, one thing I was also thinking, what has changed with the implementation is also that the unpredictable happened, and there's the pandemic. Now we talk a lot about building back better or recovering better, and we are using the SDGs also as a sort of instrument to address the post-recovery you know, period in terms of economic, environmental. So the SDGs also changed a bit also their role as we got along.
Paola, another, before, if I may just interject just quickly again, another really good indicator which springs to mind, and Habitat's doing a lot of work on this, is looking more closely at public space in urban settings, because public space governs a lot of what's going on in the city and what happens. I mean, nothing, of course, could be more relevant than in the time of COVID, where you know, the poor people don't have the space that the rich people do. Okay, so understanding the spatial arrangement. So this is another example of an indicator which isn't so difficult to measure, but has a huge impact on a lot of the decisions we're going to make. Sorry, it just sprung to mind.
That's crucial. That's crucial. Like homes and public spaces were the only areas, right, that we had available during the pandemic, and many people didn't have adequate housing. Also, to say, well, you know, you have to lock down at home. Well, yeah, you have to have a home, right, or adequate home to do that. Look, I think we are getting closer to an end. I see that we had over 160 participants. I see that some of them are disconnecting as we get closer to the end. But before my very short final thoughts, I wanted to give, let's say, 15 to maximum, well, let's say 15 seconds to each of the panelists for a takeaway. Really, what is that you are, not that you have learned, because you probably knew a lot of the things you shared, but what is your takeaway today? So I start, let's go in which order, in the order of the panelists. We start from Susan.
So 15 seconds, to build the resilience of the health system as a whole, you really need to tack it from the point of view that it is a complex system. Some people often ask me why cancer is relevant in this conversation, and really because it's such a complex disease to treat and manage. It's an ideal, cities represent an ideal entry point to look at a complex health system and the areas that need to be addressed to address cancer. So I think my take-home message is that we're all saying that cities are an ideal entry point to test and challenge ideas and to see new ways of working come to life.
Thank you. Thank you so much. I'll go to Nika. The floor is yours. Your take-home message.
My take-home message actually builds on all that we have discussed today. Suzanne has said that cities play a fundamental role in ensuring that communities, ensuring that people, have a good life, in ensuring that, the sustainable development goals are met. I also just want to, point out again and, kind of link this to what Graham has said, that data is important, but we don't have to look at the big, complicated data. Sometimes it's the small things that really matter. And so go about looking for those small things to enable you to drive change in cities. Thank you.
Thank you very much. And I see you're all very disciplined, sticking to the 15 seconds that I gave you. Shalini, you're next. Your take-home message, please.
Thank you. So from our experience, really what makes success in a project or initiative like this is, first of all, having all the stakeholders around the table, having a common understanding of the outcomes and the expectations for next steps, needing and to have talent as much as we need technology, really relying on that multidisciplinary realm of experts in clinical, local policy and global perspectives of the issue, and having a focus really on co-creation and focusing on people at the center of everything, because really with everyone a part of what's being created, the success of the project can really be sustained. Thank you.
Thank you so much. Graham, over to you.
Thanks, Paula. Yeah, I mean, look, let's COVID is, to a certain extent, I think we can all agree, put cities on the map even more. And it's made people realize the huge unlocked capacity that's available at city level to really make things happen. And I mean, I think this is a lesson that we all knew that before, right? But most of the people outside didn't. And this is why, the work that we're doing with UNECE on the Forum of Mayors and empowering city level leaders to be there. You're at the coalface. You look up to the national government. You look down to the community. You're the people who can make it work. So.
I don't know if you lost Graham as well. Probably will come back soon. But I think that then I move. I actually should thank. Yeah, you're back, Graham. Sorry, we lost you. Perhaps you want to repeat just the last 10, 15 seconds.
I said it's not all doom and gloom. I said we've learned a lot from this terrible pandemic. And, there's been a great experiences from different parts of the world, which we can all learn from. And so I think, let's put a positive spin on it and move forward and support our local authorities and mayors as best we can.
Thank you, Graham. Thank you for mentioning also the Forum of Mayors. And I hope all of you in this community that we have now will also join us for that event in 2022. I will be very brief on my takeaway message. And actually, Susan, you're the one that really gave the sentence that made me thinking throughout this meeting, which is keep priorities local. And if we do that, everything comes together. The use of data, how you collect data, how you use digital technology, how you engage the community, how you forge partnerships. If you keep the priorities local, then everything comes together, as well as the assistance is what Graham was mentioning, technical cooperation. The moment it's focused on the community, then it's likely to work and will not leave anybody behind. So I think this was my takeaway message. I am planning to close as we have 5 minutes past our closing time. As I said, we have some participants that are already leaving us. Before we do that, let me just remind you 2 things. The first one, of course, that we will have a summary of these discussions that were quite fruitful and interesting. And this will be shared with all participants and a recording made available for sharing. You see there is this recording sign on the screen. So for those that would like to come back to it or share it with someone else, this will be possible. Last but definitely not least, let me remind you again on who was behind this event and thank them again. The co-organizers where you inhabited, the Geneva Cities Hub, City Cancer Challenge, with the support from UCLG and Devex. So thank you so much, because it's thanks to them we can really have these conversations, which I found very useful and hopefully leading to more discussions and more debates, more Geneva urban debates of this type. And for those who are based in Geneva, I'm telling Graham, telling Susan, and we might even have lunch one of these days all together, as now is possible, of course, outdoors, safely, enjoying a nice lunch together and exchange a few ideas. So with this, I thank you very much. Again, thank you to the organizer for inviting me as moderator. It's been a real pleasure. And thanks to all participants, many people that stayed with us throughout this hour, and I hope that they found the event as interesting as I did. So goodbye to everybody and thank you again.
Thanks, everyone.
Thank you. Bye-bye.
Bye-bye.